and they are 25th February. And to check here, I just can answer na February Bosman here, Kogunyanko Pony at Dini. I was your mamma now called Baba CTV Clinic, so a drew and neck, who quite say ya na a brass so say a chicken cover. If I may any wo, ya pomodin home and some of our pomodin one some day, the Biana make cancellation set. Was the cat 9 mana unia pomodiamo forget. Forget is as the cano and for so be any so be never diama war. And tea a blue sabre and watch your bell fidino. Now what free will be. Now being so free will be set. And I say, Afia Brempomaa Hinneh, one in a bedroom for not to say bill in tea, mon chain and make fidino. And there, yes, I about the ginger a pomodin was some bill not topic, you know. And you mujabro swabusia. Now, send me in hospitals, Kakra, because 37, and I'm a call Kolibu. Now, Nipa, Ababajaya, Shano, do born one, a command who are much tree, you know, not just say Mujabroso. Where else no Mujabroso? Where else no Mujabroso? Mujabroso, Nipa, a pum woman, and Yasan Ketua in a year. Nipa Mujabroso, you want one coffee on some no, anon, a day. Now, so, ya bet me a who be ana. Aye, it's in an air transia. Ye babety home come way. Yamia had me or doctor penny more. Doctor Cassie more. Well, no was ya dear or Mamunia on it. And Jabusia, and then society bear were feeding the son, say their doctor for my country was a million near that hospital. And to her near bear consultation, a hey near doctor for a bit in come brand swan. Now, what back man so? What was that doctor? Question Pia. If I hypertension, or if anything that is bothering you, Doctor Ayokrado say, oh no, I bet you home come on way no a day ama war. Ya say any Doctor Vanessa appear a champon with their company. Na so Kaisa Doctor Noa, one catchy, was all kind. Aye, and then so Nadaruma was I abba, and no a barbet was so. Well, no, and or you see you, and after medical director. Or you see you, and also medical director, Emma Accra London Health Center. Woodrow, Silver Star, where is Silver Star? Oh, that 18 honor. On say, I understand about the Kakra, Bonum. The hospital, no, a hospital can say, or more a year, and the doctor Bekan has said, in Tiamana Quaba, Naya ship, on the channel. I say, you better fear, Brempomaa Hinneh, and so.
Thank you.
I was now, country I don't work and so it's okay. Look, and they share pulmonary hypertension. But for me, pulmonary now, my candidates, I mean, can't take taste from the hour of my life more for power for some to do. Yeah, hypertension. Dear Minim Kakran say Mujabruso. Now Mojano so crown, I don't know why I send us how Buruswe,
No, thank you. So hypertension. So if we just stick with hypertension first of all, so it's about when our blood pressure, so blood goes around our body, the heart, it pumps blood around the body, and every day. But then sometimes the pressure that is needed to push the blood around the body goes up. And when that pressure goes up, that's what we call high blood pressure, hypertension. But what we know about that is that because the heart has to push a lot, that means that your arteries, your veins, you see like the little tubes around the body that the heart is pushing the blood through, those have become tighter. They're not as wide as they used to be. And so that it can be harder to push the blood around the body.
Not just say, Akomano,
exactly. So when you see that, then that's why we say, so you take your blood pressure. So you put the blood pressure monitor on your arm, and then it will give you two numbers. It will give you the first number, the top number, and the lower number. And we say that the normal numbers that you want to see, the top one, 120, 120. The bottom number we want is 80, around 80. So if you do your blood pressure and it's above
doctor,
that.
No, yeah, friend is so doctor
And then when you see the numbers that are higher, so we'll call 130, 140 at the top instead of 120. And then the bottom number, you see instead of 80, 90 or 100. We don't want that. We don't want that. We want the numbers to be around 120 over 80.
Just say more than that and what if say a less in swear?
So if it's less, your friend of hypotension, low blood pressure. And even that is a problem, because if you see that you see low blood pressure, it can be for many reasons. So you know, if someone has an accident and then they're losing blood, when you do their blood pressure, you see it's low, because they've lost blood. As well, sometimes that if someone isn't getting enough fluids, you know, then that level can go down as well. Also, if your body is not making enough blood, and you can be anemic, you know, the blood level is low. You can also get low blood pressure. So we want the blood pressure to be around 120 over 80. If it's low, if it's always high, then it's important to see a doctor to understand why, to get the right treatment.
And then to see a doctor, to see somebody, I don't want to hear it. Yes, the last time I told you, said to see a doctor, doctor
I know.
So direct the people to you, not to somebody else.
No, it's true. And you know, that's the reason that I'm here, to really show people that there are people out there. So like me, I'm at the Accra London Health Centre, I'm at Laboni, and we look after everything. So if there's any concerns, just come so we can speak to you and go from there.
Exactly. Afia a day eba. Say kase moja broso de a. Ene se ranka me tumiri na me brena me betra me teswa. No say ba sa na home no kosro no wo betimi anya moja broso. Well, layman's.
No, that
you understand.
Definitely. You know, you're right. You know, when you're stressed, you'll be sitting there, you're thinking about everything, then your mind is going, and you can feel your heart going fast as well. So I'm tapping my microphone. The heart going fast, palpitations. When you do your blood pressure, you can sometimes see your blood pressure go up. So that can cause it. But there are many other things that can cause it. Our lifestyle, you know, when we have too mumuch salt in our diet.
And Doctor Sam so near Diani no more. So when your life to produce I don't know the answer.
It's true, but you know, I say to everyone, moderation. Moderation, because salt itself, it can affect your blood pressure and it can push it up. So our lifestyle, what we eat, certain fats and oils, all of those can contribute as well. Lack of exercise. So, you know, when we're putting on weight and weight gain, and then with that can come lack of exercise, with all of those can be factors that can raise our blood pressure. So that is important. Number two, you know, our genetics, where we came from. Many of us, we will say, oh, our mom had high blood pressure, our dad had high blood pressure. So we know that it can run in the family. So genetics is another important part of it. Smoking.
Shisha.
Everything, but mainly cigarette smoke. Cigarette smoke is the one that can really raise your blood pressure, so you have to be very, very aware of it. And there's some other medical conditions that you can have that can be associated with high blood pressure as well. So things like diabetes, sometimes diabetes can be associated with, it can cause it, or high blood pressure can be part of the diabetes as well, causing it. So it's important to know about all of those.
Look, hypertension I can wasemi ebia bibi ebetimi esi ama mo doctor for the answer no be ba ya mo be diagnose no completely say nipa we and as asmesi e hypertension. There are some causes and as symptoms yeah be done ho adi a e be hu say the ACA well, me years of experience, but let me say, it be a hypertension, what are some of the symptoms?
So one of the important things to know is that it can be a silent killer. You've heard hypertension, silent killer.
Oh, tired.
Yeah, because sometimes you can be there, you wouldn't even know that your blood pressure is high. That's why we always say to people, you know, we're saying about coming to see me, definitely, but you know, when you go to pharmacies and they always say, come and check free blood pressure check, please go. Yes.
Take advantage.
Take advantage, because you can be sitting there, you're going about your everyday and you don't know that your blood pressure is up. And when your blood pressure is up, this hypertension, it can cause many things, many problems in your body. So number one, it can be a silent killer. So that's why we ask everyone, know your numbers and get it checked. But also sometimes you can see people and headaches, you know, they get frequent headaches, low energy, they haven't got the same energy to do things. Exactly. When they're doing anything, they can be short of breath. And so they feel that and when they're doing it, they don't feel right. So those things can be part of it. There are other things, you know, we'll talk about it more, but sometimes when you see that someone's legs are swollen, and you see that you're not sure what's going on, for us doctors, it's a sign that we have to understand what is happening with the heart, and we want to know, is blood pressure a part of it as well? So lots of different things that we can pick up, but it's so important because for many people there are no signs.
Chest pain. Can it be associated with the
So chest pain, that's very important, because, you know, chest pain, when we think about it, we think about it when there's any problems with the heart and how the heart is pumping around. So if the heart is getting tired and it can't push as well, and or there's been damage to the heart, when we call like heart attack, that's why chest pain can be one of the signs of that. But also, you know, when we talk about the heart having problems, hypertension often comes with it. So when you're getting these chest pains, when you're getting these shortness of breath, then it's something that we say, okay, we need to look into as well.
Okay, yes, pulmonary hypertension, because I want to do back up, but baby, every day, I just said, my bonus, I was for her, show TV, no, so, oh, near, and then I'm home. Doc, my boy, what TV sway?
Yes.
Me who say I come out, say a brabo, say a dear you.
So you see here, so your pictures here are very good. So the organ that you are seeing, the one that's going round like that on each side, those are that's your lungs. Okay. So yes, so that is where you're getting the air from to breathe from. Then you see at the center there, that's the heart. And then you see the blue curves and you see the red curves. So those are your arteries and your veins. So those are what communicate from your heart to your lungs. So one of the things when we talk about high blood pressure, we say that the pressure in the arteries, the tubes around the body is high. There's high pressure there all around the body. But when we say pulmonary hypertension, that relates to pulmonary is lungs. So when you're saying pulmonary hypertension, you're saying that the arteries that take the blood from the heart to the lungs, there is the problem. Okay, so if you see, if you think of it to say plumbing, tubes going round. So if you see that from the heart, the tube from the heart to the lung, if there's a problem and it becomes narrow, for the blood to go through, the heart will have to pump even more
harder.
Exactly, to get the blood through. And see the picture there, they're focusing on the right ventricle, so the right part of the heart, because it's the right part of the heart that pumps the blood through. So the right side of the heart is pumping and pumping, and it's harder for it to do it, so it can get tired. So when it gets tired, you can see that it will be pushing and pushing, and sometimes it will just relax because it can't do it, and then again it will try again. So your friend, if it keeps going on like that, that's what we call heart failure. Because the heart gets tired, it can't push as much. Exactly. So when it's doing that, it's pushing and pushing, and then the heart is not pushing as it can't do as much, and then over time it can get bigger and looser, and then it can cause what we call heart failure.
Doc, this is very scary. It's very serious. Not just at a point, you know, you are going home.
But you know, the thing is that you're right, it's serious, and that's why we're talking about it, because people don't know about it. And one of the things is that when the heart is not pumping as properly, that's why sometimes you can see the swelling sometimes in the legs. And then sometimes when you're, like we're saying, you can get chest pain. Sometimes when you're lying flat at night, it can be harder to breathe, because you can get fluid in your lungs as well, and in your chest. So not just here in your legs, you can get it in the chest as well. We call that pulmonary edema, you know, and that is because if the heart can't push as effectively, then you get a backlog. You get a backlog of fluid, and it goes into the lungs, and it goes into the legs.
As my walking dog, I say I can relate, because just last year, around October, I lost my uncle.
Oh, so sorry.
And now what I call at a point, doctors say in Subia Bejina, wherever sana coma home, sana lungs home, they couldn't explain it. Said
yes.
But my uncle, before he died, he said, Otanasi say, yeah, it's hard for him to breathe. So, or that was say, so it's hard for him to breathe.
Yeah.
And I just said, oh,
yes,
like that, and you could see say or he was struggling, really struggling. At a point, now was one within to oxygen. So oxygen, no that or oxygen or so washroom.
Yes.
Or we oxygen from here to the washroom. Bang! He left us.
Yes. I'm so sorry to hear that. It's serious, because to say, if you think of the lungs, to say balloons, you know, you blow into it, and if you don't have enough air in the balloon, it goes like that.
Exactly.
And it's the same way that if you if there's fluid in it, you can't get enough air in the lungs. So then the lungs will just collapse down. It can't do what it needs to do. So when you're there, you're trying to walk, you're trying to do stuff, the lungs, it finds it very hard to do the work. That's why we give oxygen, to give some help, but sometimes it's not enough.
What the camera actually say it can be inherited. Genes, no. Yet here baby and share genes, genes. Yeah, po genes abeka ho. It is will be over busu no more. Probability say obenya bi no e wo soro. Ene ade na day doctors no ye ne sen. And na day na mu. And san mo abeka say finally we dey wo sa hypertension I can especially pulmonary hypertension.
Yeah. So first of all, you know, with pulmonary hypertension, one of the things is that if someone, you know, like to say asthma, some lung diseases be, again, this is why we tell people to go and get checked, because sometimes we have these conditions and we don't do anything about it. And when you've got conditions like of the lung, your friend like chronic lung disease, you have it for a long time, that can also contribute to the the blood vessels getting tighter, and that can contribute to pulmonary hypertension. So that is one thing. Other infections that the body has, it can be associated with it. Things like autoimmune conditions, to say like lupus and things like that. All of those that can affect the lung can cause particularly pulmonary hypertension. Exactly. HIV is one of those infections that is not managed, and that can also cause pulmonary hypertension. So all of this, you know, is about really knowing yourself. And sometimes we are born with some conditions and we don't know. You know, and if we haven't had a chance to go to the hospital, and as you grow up, you are known as someone that is always having difficulty breathing, but you don't get it investigated, that can be something else as well.
When you not just say you are going home.
Yes.
When you're going home, now who hear me pa because nyame ama ye nyina ye nkwatenten ti aka me no mienu say bebo ye de ho ban wo didi agro agro edu me na adwuban ne kan o so didi agro edu enkola timi nya bi menim ne sempanyimfo de wodi kan aka kyerɛkyerɛ nioma e betimi ama me panyimu manya bi e bi won kwala mu.
Yeah, so you can, like I said, for some children they can be born with heart conditions, so the heart itself isn't pumping as well, or the lungs themselves are not fully formed, or there's a problem. So children can get it. And also if they've got other conditions like other autoimmune conditions, or sometimes, you know, adults and children, blood clots. So if you have a blood clot, we think of it in our legs. Sometimes they can go to your lungs, and you don't know. You're having shortness of breath, and you're not sure, and the clots are blocking the arteries and causing problems, and that can happen in older and younger people. But for children, it's generally conditions that they may have been born with, or that is developing, that causes the problems.
Now say not may translation which I do. I translate from Tree to English and vice versa, and or your doctor. Nejuma back when he wanted to put it in tree, so that other people can also read, because not all of us can read English. People can read tree as well. And one thing me taking notice of, the fact to say at a point, the cholesterol be also when you pedenu mo a blood ni baby to me a clot share veins in the baby, and then that can have a serious implication on your health, especially your heart health. Or can hockey to be many old doctor idea.
No, definitely. Because so like we're saying, we've got hypertension, which is the arteries all around your body, and then for pulmonaries, particularly in the lungs. But yes, you're so right that heart health, when we investigate you, a lot of the time we will check your lipids, we will check the fats in your body, we will check cholesterols, and that is important, because if there are too many fats in your body and excess cholesterol, the fats can lie in the tubes, in the arteries and the veins, and also it can lie around the vessels as well. So it can, and you can imagine, to say if it's lining it makes the tube thinner, you know, and it can block it. So that is very important in your heart health, that when the doctors will say to you, okay, I want you to take medication for the blood pressure, and then they will say, I want you to take medication for cholesterol, and they'll measure your blood. They'll say the cholesterol is a bit high, so we're putting you on treatment. Sometimes patients will say to me, oh doc, I don't want too many tablets.
You are dying. You don't want to watch.
And they don't want it. And so I tell them that it comes together, because there's no point me helping the blood pressure if you're constantly filling the tubes and the arteries and the veins with fats, so you want to get rid of the fats, and then you also want the heart and to be able to push things easier. So I tell people, please, the medications that we give you about your heart health is because we know that your heart is related to your food intake. It's related to the fats. it's related to your liver. There's so many things that one can affect the other. So we check everything, and then once we check, then we decide, okay, we're going to do this.
Enti no the na doctor kan abuso me hwe wanim na men cancer mi nchiro hwe doctor ka kire wo se wo check wo chekire wo nsa no a e wo se doctor hu se eye esoro ne 120 ase no eye 80 anything less or more just a adwen na just say wo se doctor 10 omodo to aduro bi so monitor wo kakra ansa enti udu doctor no no on nanim de aso kasa mema we ni na akọje achinye a doctor me entina manya doctor because abotra ni minni oh yeah minni sa abotra ni me mo akọ na wa so you doctor you understand hey, if you are a doctor then kono wadro na me ho ntomi na obeye oba me obeye
it's true, but some people, you know, I understand. They, first of all, not everyone explains it to people. You know, to say we're here having conversations. For some people, they've been given treatment, but they don't even understand what is hypertension.
But they may be so.
You know, and that's it. We have to tell people, ask why you given this medication. If someone says to you high blood pressure, you ask them, please, what is high blood pressure?
Exactly.
Because a lot of the time, people will think you know. They will think you understand.
Okay, now yemra ni cure no so bet me cure completely. I bet me so now they've been rid of it.
Yeah,
you are free to go home.
So the treatment and how we manage it depends on what is causing it.
Okay.
So there are standard medications that we will think about. So when you come in, you know, we will say to you, okay, we want to do a tracing of your heart. We call that ECG.
ECG.
We will say that we want to do ultrasound of your heart. Your friend of echo, echocardiogram. Then we'll also say that we may need to do a picture of the heart. So we want to do the friend of CT scan.
CT scan.
So we'll be doing all these things to investigate. That will let us know, okay, number one, what is the problem? Number two, do we know what is underlying and causing it? In addition, we'll do bloods as well. So when we find out what is causing it, then we have to also, we treat the symptoms. So we want to get the blood pressure down. We want to get rid of the fluid. We want to give energy to the heart. But at the same time, we will also see if we can treat the underlying cause. But for some people, dear, like I can give you medication to lower the blood pressure. I can give you medication to get rid of some of the fluid. But if you've got, let's say, chronic lung disease, the lung disease, the lungs are very damaged, I may not be able to cure you. I may be able to give you good treatment to improve the lung function a bit, treatment to reduce the blood pressure, but I may not be able to say to you, that is it.
That is it.
Yes.
See, now then doctors are confident.
Yes. Yes, but there's some things that we know that we can't get rid of it completely, but we can make you feel better. We can give you a more comfortable life. You're able to do things. You're able to go upstairs, do your shopping, dress yourself, you know. Some people, they'll be there, they can't walk, they can't dress themselves, they can't go up the stairs, but they still don't want to talk to anyone. They still don't want to do anything. But there are things that we can do to ease it, definitely.
Doctor, are you true, say hypertension about swa? Aka, there is no way, say, it be free or so. You'll be on medication for the rest of your life. Is it true?
No, so it's not true. Number one, everyone is different. But for many people with high blood pressure, you know, like I say, we have to understand what is driving it. For some people, you know, when you're monitoring and you catch it early, I say to people, lifestyle. Get your lifestyle. Let's optimize it. Let's do the right exercise. Let's improve your diet. Let's stop smoking. Let's see if we can get your weight under control. All of those you can see, reducing salt. All of those you see sometimes that the blood pressure will just go back to the normal range. So what we do is we say just monitor, keep monitoring it and go from there. But for some people, you do all of that, but it's still not shifting. even if you're doing all of that and it's not shifting, do not stop what you're doing.
Stop it.
Because that can be making it better in ways that we don't see. Okay? So keep doing it. But then we can give you medication. Sometimes we can give medication and for a shorter amount of time, we're monitoring and it's settled. But for some people, they have to do it for extended time. But what I say is, that's why it's important. Number one, if you're given treatment, stick with it. Number two, if you're given treatment, go back and get follow-up. Because in that follow-up, they may say to you, okay, things are going well. I can change your medications. I can reduce it for you. I may stop it. I don't know. Everyone is different. But you need to listen to the advice. You need to make the lifestyle changes. Take the treatment and go to follow-up.
Follow-ups. Oh, so at a point, you know, obi no medro now, so hypertension edro there. No a flash. Or the good toilet no a flash. Me madam for be our ebida. We no na or no nom asofofo so bolo ni bi. Koto so bolo be say 1.5. Na wanom hoping say ebe bi because ni gidie e was sad. And so yeah, Juma Kakra.
So you know, one of the things is that the two things that you brought up there is like the faith and then some of the concoctions that people will take. And you know what I say is that number one, there's no reason why your faith and your medications have to be separate. Okay, I talk about this with patients all the time. Your faith is powerful. Your faith gets you through the day. It doesn't mean that you have to, because you're taking your tablet, it doesn't mean that you're not being faithful to God. No. I believe that God has given people knowledge to create these things to support people. So that's number one. Number two, you know, there are many things that we know for our natural herbs, our natural drinks that can really help with blood pressure. We know that things like moringa, turmeric, you know, all these things, and prekese, you know, very good things. We are blessed with what we have. All of these things can make a difference. So for me, I say to people, if you're trying it, try it and see. Number one, you have to monitor the blood pressure though. So you don't, if someone tells you you've got high blood pressure and you say, doc, I want to try this, I'm changing my diet, I'm doing this, and then you go and do it, but you don't go back and you don't monitor your blood pressure. And I've said to you that blood pressure is a silent killer. That is where the problem is. The problem is not the prekese, it's not the moringa, it's the fact that you haven't gone to follow up to see if it is making the effects that you need. That is really important. So there are a number of good herbal things, but I often say, tell the doctor what you're taking as well, and then let us make the right package of care for you.
I am the said doc what bought in habanero no so prekesenom obo moringa so obo turmeric so been friend turmeric whatever the other body be is accepted binum grass chia seeds ne one no no and also ye ne mom sanya wo kan no aduro na doctor de ama no de nom ne mom diet no and so hwe ho asem kan isan say bibia untimi ne di so chen da bia sa da bia woduane ne ye oyile akokọ ya chie ohun yenum ye de ya doc aduane na de akokọ ya chie ohun wanya fried rice bi na de akokọ ya chie ne guso ohun ye nya fa lines no ye nya frɛ ye mposo ma chance ye frɛ abusu ma chance ye frɛ de ne no ano no ye ntinsime 0302771593. Hello, good afternoon. Hello, good afternoon.
Hello, good afternoon.
My first call I that's you. We didn't be free Tinkwa.
Pacho Made Mamiska.
Okay. Pacho Mentia, who tear me off phone, so why?
Pacho free. Pacho me free Accra.
Okay, Pacho Yankwe.
Actually, the same business doctor say made a BP drew so for a couple of years now. I did be a me family drew, but and then 2 days all of a sudden my family drew people. But me one na issue to cause so with no reason be and I didn't call hospital and check and I said me BP issue to cause so but now my family drew no panel before. So I wanted to find out what really can cause that.
No, thank you. So we're saying that you've been on blood pressure medication for a long time, and then the last couple of days you've seen the blood pressure go up suddenly. So the thing here is, number one is
Doc. What man first sister or baby say or bras. Hello, good afternoon. Hello, good afternoon. Fast.
Okay. So it can be any number of things. One of the things is that sometimes the medication that you're on, it's not doing what it needs to do. It's not controlling things in the same way. And then go and review it and change it. Okay. And also check that there's nothing else going on in the body.
Hello, good afternoon. Hello, good afternoon.
Hello, good afternoon.
Pacho, oh, friend, I meant TV ni bio. See me on phone, so why? Pacho, baby, I'll free, oh, mammy.
Afternoon.
Would any baby I'll free?
Oh, my dear, yeah, my casa 3 and 7.
Okay, yeah,
Me say, me so me pressure maybe. But so that do on ma, me no ma. Me no na me ho yam basa. No pese me bisa o.
True no. Ono so no ma na ho yam basa ba. But your fato so net here doc why? Okay.
So taking it can make her feel unwell. So what I say again, you have to go and speak to your doctor, because number one, it may be too much. So it may be bringing the blood pressure too low. Number two, you may be taking other things that could be affecting the medication. Okay. And so it's important to go and check and see if we need to change it. Come to the Accra London Health Centre.
Thank you. Hello, good afternoon. Hello, good afternoon.
Afternoon.
Pacho, we didn't baby free, Papa.
Pacho, me di Gloria, me casa fi Newtown.
Pacho, yeah, that's in Newtown for you now. You chamo. I say, question, the doctor, are you ready?
Me problem ne say, so we no BP draw. BP draw. How many minutes now? Me chance na BBD no. Prekese no one no. Me tanum prekese pa, but I was then say me chance na manum.
Okay, doc, ready a quick one.
Okay, yeah. So I would give it like 3 to 4 hours before doing it, and then also you do your blood pressure when you take your medication. Do your blood pressure after you take the Percocet a couple of hours later to compare, to make sure it's not coming down too quickly.
Timami, also, we no more Percocet. We are not quite sure when Sana me are senior. Pressure no esi ekro say wasro say e wo form. Why? Yeah, that's a pa 0302771593. One so friend, now doctor, are you ready? Hello, good afternoon. Hello. Me power show. So friend me when the TV na ya kawo. E tie me wo phone so. Why? And I say na what dum TV no volume no. Ansa na when me akasa basa e boama nkomo no. Etumi ekoso pa. Hello, good afternoon.
Good afternoon.
Our first mail. Good afternoon, boss.
Hello.
Yeah, I'm Pacho. We didn't baby are free.
It's Anya.
Anya, mature your voice, Kakrama.
It's Anya.
Mo, Pacho. A question. The uncle doctor are ready.
The doctor, my question is, can BP say 120, 80? But last me got 30 million, 175, 173, 75, 75, and yeah.
Yeah. So that is far too high. So you need to come and see me at the clinic, because it's too high, and we need to see you immediately, check it and see whether we need to start you on treatment. When you're going above 140 and it's always more than 140, that is a significant problem. So we need to be on treatment. But 170, yeah, 175 is you're in the area that you can be a high risk of stroke and other things. Jesus. So please come and see us to be reviewed.
And boss, Miss Rawa, was a brand 10 times so na be huna ni mu ya ma de enche so. Because here ya our hospital honum na wakoto an adwuma so the number so beto dwa ansa na wafiri ha ko fa number no na di nachi na onhwe wapomuden mu asem ansa say ye collect ye dom pa empese ye be hwere obia 0302771593. Hello, good afternoon. Hello, good afternoon.
Afternoon, madam.
Mpacho wudi ni baby afrefri mame.
Mpacho me dey for see me frefri is Legon.
Is Legon. Ye cha is Legon fo nyina.
Yo.
Mpacho afema o question him right.
Yo. Mpacho me so there me say ya na me heart.
Akoma no.
Oh me chest no. Me half me right no. Me yapa nti bi wa me wo kwa na asemi wo me tu o makoma no. Say ayasa funny afa me feeling na fa mechi anti me nim de koso makoya kocha every ma say atwa 3 times for say almost say me depends no me no fun inside ko inside akata by 3 years me o ma check doctors for check me cancer so by na say me ko twa we no almost tissue go inside. The minimum dear me oma me draw so as a painkiller. Painkiller me no na mada. So na we me na me pen na me ko twa we no na me me dey say doctor bi no tissue doctor me bi na me dey asho say as oma tissue go inside. The minimum doctor me ko no ho no
doctor no put den ha ho na bi na wo fie ha no. Why? Doc,
yeah. So there's many different things. So we need to first of all kind of start again and understand what's happening. We need to understand what's happening with the heart itself, with the ECG and doing other investigations. Then also with the chest, we're talking about the lungs. We want to. You said that you've had multiple X-rays, I think. So, but I need to look at those and see. Also in our chest area, you've got the lungs, you've got the heart, but you've also got the bones and the ribs, and in between the ribs, the cartilage, and all of that. Sometimes it can get inflamed and cause problems. So maybe that's why they've given painkillers. So please come and let me see you.
Exactly.
So we break everything down, and then I can explain to you why I'm doing one thing and why I'm not doing another. It's the explanation I think that she really needs to understand what's happening.
Okay. Me sure so when you want to say you. Hello, good afternoon.
Hello, good afternoon.
Pacho, would you need me man mo fresh na me hoye me depa. Would you need be free?
Pacho, I me kwabena me free sutu.
Okay. Pacho, you okay?
Yo, dashi. Pacho, a woman na me nine right one no. Mo me she. I feel last week me consider me some na see 195 over 130 the that way. And I feel me so right one no. And one the papa say there.
Okay.
Doc,
so again, you have to come and be seen. So number one, the blood pressure is far too high. But when you see the thing that I'm concerned about is when we talk about high blood pressure and we talk about the complications. One of the complications is that if you're not getting blood around the body.
Producer Miss Rafa, ni pa me no pet me wate. Say do amu say friend wadaroma. Why? Me no pet doctor so.
Yeah. When you've got you're pushing blood around the body, it can't get everywhere. So one of the things
you cry the dog show. Yeah, more time abusia for mumra say na sene 2 hours na doctor consultation kwa. Good afternoon.
Hello, good afternoon.
Yes, ma'am. Pacho, we didn't be free. Yeah, Commodore.
But my father, checking the people man like never and 200.
So, my own and so kakra me and I enter crowd.
But my father-in-law. Checking the people man like never 200, 120. So, uncle, hospital, so I was told the baby asana, the BPTA.
No.
Oh, yeah, won't sign on the BPT.
Oh, so they be a sign.
What
But they do a question.
record with the doctor, cook everything, or ban one watch, and why?
That's you.
Okay, again, we've been these blood pressures we're seeing are far too high. When you're going around 200 and 100, for me that's like a medical emergency that you have to be seen immediately, to be reviewed, to bring medication to get it down, and then to have other medication to control it. You see, again, I said blood pressure is a silent killer. He'll be there, he can be going to work, and then something could happen suddenly. I'm not going to use my mouth to say it on anyone, but I'm saying come and be seen. So please bring him. People will tell you, oh, it's fine. It's not fine. It's not fine. Okay.
Good afternoon. Okay, what's your uncle?
Me pacho program me share na me pacho me was sugar, but they be me check na e wo so. They be me check ntumi mba from 15. No asan ko 16, no asan ko 15. Ntumi mba from na me bi say ano so dey.
Mo Doctor Wahamuntia near Wahamame, Fato Suneti, what? Yo, dog.
So
sugar.
The sugar. So that is just showing that it's not under control. So you can treat sugars with diet and improving your diet, but when it's persistently high, we suggest medication. I'm not sure if she's on medication, but even if she's on medication, she's not on the right one and not on the right amount. So again, she should come to the clinic, Accra London Health Centre, Laboni. We'll review her, we'll check the levels, and then we'll give her treatment and then monitoring. You see, sometimes someone has given you treatment years ago and you're on the same treatment and you're not monitoring, and that what they gave you then is not what is right now. So she has to come in and be reviewed to get the right treatment, because complications could happen with high sugars like that.
No, couldn't say where do you betray me a pong because my hair Davidson or the ma never be pan. Obi honoma a drone or call a doctor and a trauma no one no asan ko pharmacy.
Yes.
No the box na e dey drone shame no man na. No asan ko tofu from. No asan benom. Esan. No asan ko tofu from.
Exactly. Yeah. And I'm saying that needs to change, because you see, like I said, what was right a year ago may not be right now. So at least twice a year you have to be going to see the doctor in between. For me, I will say that regularly, every 3 months, if you've got a chronic condition, go and get checked. Exactly. But at a minimum, you have to be going twice a year to go and check, just to check that everything is okay. Because that's the whole point. Our bodies change, and sometimes the medications we have given you may not be the best for you all the time.
So for I am a yasen na DC has said, because I'm on for issues upon issues, and I was a doctor. Hey, you did home come on. Nyame adma next week, message doctor. Nyame adma next week, when the doctor and the Tiffy has say po, ye best had another. Share your pomo de ho asem de ho here, was see a di home come on to no one. Nyamwa next week, how be whatever topic we discuss, and fa home. Doctor Afia onim de nti what the question ba na wayi ano ama doctor ye pon baby a wadwuma ekuo no hospital no wadwuma ekuo kra de asama hospital no baby a hospital no wo time am we adwuma and wo phone number be say be friend na we kwa see a receptionist sound of phone chiro mo chiro mo ho ba doctor ni ho doctor no ye mpebi wa number fa to jale
don't worry, it links to my phone. So number one, we're the Accra London Health Centre. We're in Laboni, Daddy Link, and if you Google it, you'll see it. There's signboards around Laboni, opposite KGL House. You see it down the side road, and our phone number is 050 333 00 60 again 050 333 00 60.
Doc share afen will be kofa ne pen.
Yes.
Nti mbacho wa fa pen and book no. Okay, doc, yes, uncle.
One more. 050 333 00 60.
Accra London Health Center. Emma dini hunehuna. Emma dini hunehuna. Omo boa da form. Why? A boa no da form. Kra London ne be share hono. Ena Accra na yedidi kan no. Emma ni hunehuna. Ko na doctor enshow. Wamu wonfidie me kan fidie na me kan be fun fidie. Ya wo be hwe wo pomu den mu wo mpom ama yade bia wo mo atimi ako ate de ya ne se yade a ayewo na yewo anu aduru na watena ho a na yade na kum ukoto amoche wa asamado ho a wo mfa ho nchew obetwa wo mpre pa ansa na de ode be yo a wo de ayo ntimi sro Accra London for abede ye no wo emu twaso bom na fe ya pomuden ho nsem enyina ne nai so enen so ena ye de CTV clinic ya ba clinic da bia meka se edu kwada doctor ye kwa doctor na ya kwa akosho ya pomuden na nyame adom ya san aba be hwe ya pomuden ya consultation bebre ya nyu kapre enye ha ka hefa na abenya uko obi o consultation a be se 5 million no wajo na so ye consultation de free of charge de hia ne se ebo kwada na se edu kwada na ebo 1 pm donko pepepa udu afidie no beto ase na ya consultation se san se ye de adokitafo ni animdefo a wo mo nima pomuden mu nsemo ene ye ne wo mo eba ebetwetwen enkommo maka ne se awie no brabe so ye na se 1 hour ne sadodo 1 hour say ye ba consultation nipa ba akokura ho consultation bi ho no ma 30 minutes what I say nti brabe so ya sene na ye nya be 2 hours ye the 1 hour twetwen koma na ye the 1 hour be phone lines no na we be say questions 0249 142 607 for sponsorship 0249 142 607 Afei 0537 884 479 and 0535 356 560 0535 356 560 Ye from Afia Brempomaa Hinneh adwumadie nyame nko na medi yo wo mo wa kire ho wo bo a me bebro twe hunwi executive producers boss Awele boss once again God bless you. Thank you so much for the support. Afei mi ankasa mi HR Madam Abna Madam I salute you. Thank you so much. Now, Faye, my baby producers, Ankasa so Hannah Miles, and now Faye, Sika Papebi. Wamumi no Maya so no. Now, so mo boy Juma wadre. Adiana emfa so mo se befa. Wamo so adawro mo boy. Eme Jumedi no, eye krabehwe. Afei, yeba studio ha se ya, ye woni wura. Studio ha woni wura pa. Something. Sama mo something there next week, o ma me nye show no. Obetimi adundum camera no. And to Samson, I salute you. Thank you so much for the support. After Davidson, now what chair me calls me no me da sepa. Next week ya and 5. Let me who say oh boy Juma. Ayi boa me, Patrick boa me, Jeff boa me, Credible boa me, and na boss ni boss Joshua. Slow for you na medamu nyina se. Set mo so masne ema nanso CTV clinic. Ye de ebre wo makeup. Eye Leila Seidu Les Glam makeup ono so ene twi mani maami anei me de ebetena ase na ye de dwumade no hyehye so nyankopon ya adoma next week share same time 1 p.m. na ye CTV clinic hyehye so until then